see far. Distance, I meant see far, see close. And yeah, just get a little background history of their eyes. But you're gonna want to take a look. So sometimes the patients don't keep their eyes open, so you might want to hold the eye open from the top of the eyelid onto the bottom, and you just want to take your light and just look like that. You don't want to shine it directly straight into their eye because it's a little bright. Just from above, just like that. You're looking for pupil dilation. When it's darker, then the pupil will retract when it's light, and you're just trying to see the movement of the pupils. Then you're going to ask them to look up and then to the side. You're going to take a look at their eyes and their movement. Okay. And once you're done taking a look, they're going to need to follow the light. So you just move it in different ways for them to follow. Okay, just like that. And a peripheral vision test where they'll look at you and tell you when they see the light, like this. Tell me when you see the light, but look at my nose. Okay. Got that? Yeah, it's pretty much easy. Just peripheral vision, taking a look inside of their eyes, and then you want to move on to this eye chart. So you're just going to go down the row of letters and ask them to read each row from a distance. So you're going to hold it back and tell them, can you read the top row? Okay. And they're going to be from a distance, and then you're going to take this side of this and place it over their eye, and make sure you don't like hit their face with it. Just go right over like that, and then they're going to have to read the chart with one eye and see how they do. Okay? Okay, good. Last but not least, with vision, their colors. We have these, and you're just gonna ask them, what color is this? What color is this? Go through the colors, and then you're going to, the patient might start falling asleep on you. They need to focus on the color, and you need to focus too on this, so you can pass. Yeah, so just focus on me, and you're going to tell them to focus on the blue. But the red is going to distract their eyes, and they just need to look at the blue. Look at the blue light. And then they can look at the red and switch up and just see how their eyes follow the light if they're following evenly. Alright. Okay. For hearing, you want to whisper during your cranial nerve exam so that if they say what often, they clearly don't hear that well. Yeah. And you're going to take one of these. It has this top. You always need it on to be able to look inside of their ears. And you're going to ask them to turn their head. Gently move their hair. And you're going to look through this inside of the ear to see if it which ear is it in? Which ear do you hear it from? And when does it stop? Okay, the frequency is the real teller if their hearing is good. Okay? And you want to make sure their ears are clean before that. Okay, now moving on to the face exam. The movement, the feeling of the skin. You want to ask them to lift their eyebrows, scrunch their nose, open their eyes wide, and tuck lips, smile, frown. Okay, and you're going to be testing their movements. Try to notice if anything's seen. Are you taking notes? Okay, try to notice if anything seems off. They might have a numb spot on their face potentially, or a lack of motor skills in their face. Really pay attention. And then you're just gently going to feel around their face and their lymph nodes. Underneath their jaw, the forehead, check for any abnormalities. Okay. Up into the jaw right here. Okay. Make sure everything feels right, okay? And then you're going to take this. This is the soft or dull test. Soft, of course, and dull right there. And you're gonna ask them to shut their eyes. Really make sure they're shut. And tell me whether you feel soft or dull. Gently touching their face. Very gently, and then you're going to want to ask them, where do you feel it? Once you know that they feel it, say, where do you feel this soft sensation? Right above the eyebrow. Where's this? Above the eyebrow. Tip of the nose, good, and over the lips, good, and the cheek. miss a lot, or it's concerning, as in if they cannot pick up on, let's say, what's a sentence